We are SmartCare360, your new partner in care. More than just a network of medical specialists, we're a family of passionate healthcare leaders united with one goal: overcoming the many challenges associated with providing virtual comprehensive services in an increasingly digital world without sacrificing on quality of care to the patients that depend on you. Introducing SmartCare360, your patient's new gateway to happy healthcare. Together, SmartCare360 in your office can provide more services, increase billable hours, and generate more revenue while keeping more of your patients out of the hospital. All built around predetermined disease pathways that come with games and challenges to keep your patients engaged even when you're not around. Let's take a look so we're seeing a patient's view. Here, a patient has 4 primary tiles that we can adjust or customize. The platform is available in 8 different languages via both Apple and Google Android or web-based. And technically, a patient doesn't even need a computer. They can even have a flip phone with no Wi-Fi in their home. And we can still see whether or not they took their vitals and track other biometric or physiological data via their integrated smart tools. Here on the patient's dashboard, they have care tasks, challenges, screenings, data feed, and can easily view specific trends on their biometric data. These care tasks are customized and personalized around their social issues or chronic diseases that were being monitored. If we update insurance information or anything like that, it'll also update in their EMR. When we onboard a patient, we take them through a series of health assessments that have algorithms, rules, engines, logic on the background. Here we have all the different diagnosis codes that the insurance companies consider chronic. And it's the same thing with medication reconciliation. For example, if enter Tylenol, it'll all pops up here. That way we can flag any contradictions. Here you have functional health, daily living, psychosocial well-being, or PHQ-9, amazing, right? And as for determinants of health, all of those answers and questions go into the system. You submit it, and it creates risk factors, which we can then prioritize from red, yellow, or green. From there, it gives the patient an actual specific health score, similar to a credit score from 0 to 25, so we can see at a glance how they are doing. Now I told it that I have a walker, that I live alone, that I don't have a car. And so those things automatically go into a care guide, and you can see we have specific problems, goals, and interventions in the care tasks in green. Give the patient a specific 3 to 5 things that they need to do on a daily basis, and the system will do all of this extra work to incentivize them to do it. Best of all, their time spent engaging with it goes toward your ability to collect more revenue while improving health outcomes. The entire interface is seamless. As an example, I'm telling the system now that I completed my walk over here on my patient profile. You can see, oh, Kyle's completed his walk. This will be tracked and contribute to my activity. Or let's say the patient realizes I've run out of medicine and I need to see a doctor in order to fill. Okay, well, let me look at the schedule here. And wow, there's actually a doctor available in 30 minutes. All I have to do is claim it, and I would receive instant communication with the details. The patient gets the text message on their phone or their device, and instantly the telehealth visit starts. Over on the revenue cycle management dashboard, we set this up by location, by physician, by department, depending on the client's expectations. We track month-to-date, claims any rejects or denials month-to-date, deposits, and the turnaround time on the payments or velocities. Here we have a historical trend, and we can see all of the important payer data on who we're processing claims through. It really is the best of all worlds for your office. When looking at AR reports in the different carriers, simply by clicking on Financial Metrics, we're able to pull AR reports by the carrier and payer group simply by the click of a button. We can create an AR report that breaks out over 180 days, all the revenue that's coming in. But that's just the beginning of how our payment, billing, and back office solutions can streamline everything you're doing. So it's more profitable than ever before. By partnering with SmartCare360, your office can grow and thrive in ways that would have been previously too cost-prohibitive. Your patients deserve the best options for living better lives, and you deserve to be paid for delivering spectacular care. Don't wait. Visit our website or contact us directly to discover how together we can deliver happy healthcare.